Okay, this topic is about religion and medicine. I know guys will be thinking religion and medicine. Yeah. You see, I feel that parents should be arrested or stopped. However, parents should not interfere in their children's health. Say, for example, if they need blood transfusion, they should not interfere. They should not bring religion to health. Because there's certain religion like the Jehovah Witness and some
Yes,
other
yes.
ones.
And you notice that you see a lot of these stories.
Word. Religion and medicine. Parents should be arrested if they stop any form of medical treatment. This medical treatment is your son needs blood, and you come up with religion and you stop that process. I think government should get involved and put a law that as long as a qualified doctor sends a signal that this patient needs this, no religious belief should interfere. I mean, what's your take on this?
I mean, which government is it, who is paying for the procedure? Is it not still the parents?
Yeah, but it doesn't matter
You
if the
really
parents is paying for it.
like you. It matters because maybe if the government wants to really be taken serious, they should be useful.
Word,
You're not doing anything for anybody. And you're trying to make rules for them on how to.
word, word. But you see, but another point is I follow that, but when it comes to life now, when it comes to life, you find out that the government has something with life. Nobody wants anyone to die. The government have been able to have hospitals done, and they have doctors, and these doctors are professionals. I believe the doctors should be given the right to treat a patient underage if they really need that treatment by a qualified doctor.
I think that's that. If they do that, they might be because religion is like since you've given people the right to religion, and I mean, if the child is underage, the government has given the parents the right to make decisions for the child. So it's either you want the parents to make the decision or you don't want them to make the decision for the child. So it's not really as easy as it seems to
Okay.
take away that right from the parents.
Word. But it's because of the crisis that's been happening. That's why this podcast is all about now.
Then maybe they want to abolish the religion that counters practices, health practices.
Yes,
That's
however the government should do it, life comes first. I think life should come before religion. Because if life is put behind, then what's religion? Life should come before religion. So we should save life, not put religion in front and watch your children or your child or whatever or yourself die from what you need from a specialist. So the bottom line is I just feel that government should go deep and dig into this quickly. Find a way to find a law that will protect us from religion. Word.
worse.
Word.
So many people have died because of this misconception, you know. And I can bet you that you see these pastors, when they are sick, they take that blood transfusion.
Hmm.
Because we don't hear the pastor die, you know. So they probably hide and go and do all these things and come back and tell their congregation,
Don't do
don't do it,
this.
don't do this, and we fall victim over and over again. You know, there was one story about this boy crying online about his sister that just died
Wow.
because the spouse, even the spouse, it's not just parents, even the
Yes.
spouse have refused to acknowledge that this woman needs blood transfusion after giving birth and she had bleeding.
Thank
So
you.
the woman died, leaving the kids. You know, so this is something that we really need to talk about. This is something that we need to make aware.
Awareness.
Yeah, awareness.
So if you I'm trying to punch it now because
Mm-hmm.
I'm thinking, okay, the government have to get involved.
Oh
They
yes,
have to support the doctors because
yes,
nobody is allowed to die.
yes.
A doctor is professional, trained to save life.
Mm.
Why would they bring religion to saving life?
Mm.
Is my problem.
Yeah, so the only part that I can talk about is the government itself because you found out that the doctors they have they are mandated to save life, but it's not always the case because they need for somebody to sign. It's not their call.
Wow.
It's always another person's call because they are not directly involved.
Yes.
So you need
So
a member of the family.
family.
Yes.
So this is where I'm saying the government should come in
Yes,
and
exactly.
take that power away from the family. You see, the family has the power. That's why they say you should sign.
Yes.
Government should look into this because
Yes.
if the doctors, are trained and they
Mhm.
know their job,
Yes.
that means professionally they know the situation at hand and they know the situation requires blood,
Yes,
for
because-
example.
Yes.
So if the doctors are firm and we trust our doctors,
Mhm.
they should have another system that should override parents,
Mhm.
families from stopping that. What's your take on this?
No, I had to really come into this because I've had a personal experience. I was
Wow.
at the hospital, the government-owned hospital here in this city here, and then the parents, the dad was saying, no, 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 that's not true. The guy was actually going to collapse. The
Wow.
little kid, I think less than 10 years old,
Yes.
in the government hospital. You could see that he was going down, needing either drip or some level of quick intervention at the hospital. But the dad was saying, no, let them take the child to a prayer house.
Wow.
They are not supposed to do that. And that's I'm like, so really and truly, the government needs to actually think of ways to take some of that power.
Away.
Because I'm aware that parents have to sign on behalf of younger ones, or even adults have to
Sign
sign
on behalf of themselves, yes.
and all of that. So that is actually an area to be considered. These things actually happen whereby religion makes people to lose their life or be at the risk of losing their life.
Yeah.
Finally. So you see, please, I mean, we're just bringing it to light now. We are trying to treat this. We're not talking about it, we want a solution. We don't just talk. This is upfront and statistics. We find a solution to the problem. So the solution that we're thinking is that we want the government to interfere.
Very well.
They need to take that right away from individuals over the doctor, over medical. Once it's been decided that somebody is going to die,
It's in critical condition.
condition, and they need a certain thing,
Mhm.
religion should not stop that.
Exactly.
Very
Word,
Word.
Word.
word.